Hi, and welcome to this episode of Real Nurse Stories. Today, I've got the pleasure of interviewing Deanne Geddes, and we've got the opportunity to hear all about Deanne's story and why she became a nurse, and also a little bit about the work that she's doing, the really important work with graduate nurses. So welcome to Real Nurse Stories, Deanne.
Thank you so much for having me, Eva.
You're welcome. It's always a pleasure to have other nurses on the podcast and give you the opportunity to share your story. So I get as much out of these episodes as you do and the listeners do. So thank you for putting your hand up and wanting to come and share your story.
Absolutely. I love sharing stories. I think it's a great way to help connect people.
Yeah, me too. Me too. So Deanna, I'll start where I always start, right at the very beginning. And if you would just like to share, with the listeners a little bit about your story and why you became a nurse in the first place, what influenced that choice.
So, my nursing story actually starts way back. I think it was around 2000. And I was trying to find something. I was doing admin and reception work, and I was in my early 20s. And I started a nursing degree wanting to do something that mattered. And I ended up quitting about 18 months in because I just didn't have the support that I needed. I experienced my first death in a palliative care placement, and didn't really have the support from colleagues, facilitators, my own partner at the time. But then several years later in 2012, I felt that pull come back. And again, still wanting to do something that really mattered and made a difference to people. So I re-enrolled in university and I finished. And in 2014, I got a grad program at a very big private hospital in Brisbane. And that was kind of the start of the real nurse journey for me, I suppose. I did 2 6-month rotations. And interestingly, I ended up in palliative care.
Ah,
And I actually really loved it this time around. And between those two times, it was about, I guess, 8 or 10 years. And
yeah.
I experienced quite a lot of, maybe not quite a lot, but I experienced some death in my own family and my own life by this point. And so I kind of had a bit more of an understanding about how families coped, because the first time around the death, I was like, how does that family go home tonight? And what do they do? Like,
Mm,
now that this person that they love is no longer around. And I couldn't reconcile that.
no.
And then I got into palliative care. I almost kind of fell into it and really enjoyed it. And I think I'd learned a lot about myself as a person, a lot about life and death at that time. And I really enjoyed it. And even now, I find it interesting because people go, "Oh, you're a palliative care nurse. That must be really hard, sad, awful." People think nurses and they go, "Oh, everybody looks after you and you're a hero and you're all this stuff." And then you say palliative care and they're like, "Oh." and and it's like, it's actually, to me, it's actually, in my mind, we're all born and we all die. It has to happen in some way, shape, or form. So if I can make it so that that person's death is more comfortable, less traumatic, less sad, less difficult for them and their family, then that's got to be a great thing, right?
Yeah. It's fascinating, isn't it? Because as nurses, and I always think this, general public, and I know you touched on this a little bit in the information you gave me, and we'll explore that a bit more, but there is a perception about nurses and nursing amongst the public. And I think for us in the profession, we know that it's a continuum from birth to death. And, you know, the perception of working in palliative care and people who are at the end stages of their life is a real privilege, I think, to be able to care not just for the person, but their family, their extended families. And it takes a special skill set from an emotional intelligence point of view to be able to do that and do that well. And I think when we first start out in our careers, I can relate very much to what you're saying about your first experience, because I can remember very clearly as a student my first experience of a patient dying. And I was absolutely terrified because nobody prepares you for what it's actually like and what you're going to have to do under supervision, obviously. But it was a real shock. I had never seen somebody die. I'd never been involved in that process. I hadn't experienced that within my personal family or friends. So it's a very confrontational experience when you first come into nursing. And I don't think we prepare people well for that.
No, not at all.
And I think the other flip side of that is if you're not prepared for something, it causes a lot of stress and you kind of internalize that. And without somebody who's going to support you and do a good debrief and explain things to you, you kind of do come away with lots of questions and what ifs and how do people manage, but
Yeah.
it's a challenge. The very first time you come across that, it's very, very difficult, I think.
It absolutely is. And I think between my first experience and then some of the other experiences that I had through my clinical placement in my grad year, that's when I thought I wanted to be an educator or a facilitator, some sort of a mental support for newer nurses to help them through that and so that they could get that support that I knew they really, really needed, but it wasn't always available to them.
No. What do you think made the difference second time round? Do you think it was in terms of the people you were working with or the support? What made you? I know you touched there a little bit about personal
Yeah.
experience.
Think it was a combination of factors. And I think that that is another thing that I'm really passionate about in the work that I do, because it's nursing isn't just nursing. There's always it's part of our life. So it was a combination. So for a start, I wasn't a student. I was actually a nurse at this point. So I was already 6 months into my grad program. And so I went into palliative care in my second rotation. And so I already was a nurse. I had colleagues there that were really supportive. I was in a much more supportive relationship in my personal life, and I had had experiences of losing loved ones myself. So I had a little bit more ability to empathize, I suppose, and I understood a bit more about what happened after somebody dies. So it's a combination of factors that I think made the difference, and life experience. I mean, the first time around, I think I was 22 or 23. And then the second time around, I was 34 by that point, I think.
And I think that's, to me, that's the great thing about nursing today, because, I again, when I started my training way back when, everybody was fresh out of school, 19. I think on my cohort, there were 2 older, mature students. I know that's changed a lot now, which is great.
Yeah.
And I think life experience is important, really, when you're going to be dealing with a lot of the things that we deal with in nursing. And I'm not saying that a younger person can't do this. I'm not saying that at all. But I do think, going in at a young age is in many ways more stressful because you don't have that life experience to kind of help you understand a lot of, particularly care and patients who are at the end of life. So it's interesting.
I agree, absolutely. And I think that there are a lot of younger people that make excellent nurses, and they have had, I think, when we look at our lives and everything else, and we consider things like um, neuroplasticity and our nervous system and our personalities and things, it depends on what's happened in their life to shape them
Yes.
as to whether they're in a position to be able to um, process different things in the world of nursing. So some people are able to do it as a young person and they do a wonderful job and they become the best nurses.
Yeah.
other people come to it a much later in life, and I have worked with a lot of students and graduate nurses that were older than I am even, that, they had their family, they had their children, they've done their life, and then they're like, "Oh, actually, I wanna keep looking after somebody." So they've gone off and done their, a carer's course or the EN or even their RN course and decided that that's their ongoing career now. And they, again, do an amazing job. They bring so much life experience in.
Yeah. And I think the other important point there is the supportive partner aspect, because I think, as nurses, we totally get the job, but if your partner isn't in healthcare, it can be very challenging because they don't always want to hear all the bad stuff either, and you kind of carry that internally. And this is where, networks, using your network is so important, because you do need that outlet. You do need to be able to talk about, your day and the things that have happened and how you feel. It's almost, if you don't do that, you end up bottling it up, and that's where the stress and the anxiety and the burnout starts to grow. So it's a huge
Absolutely.
factor.
Yeah.
So I know that you have your own story, Leanne, and I just want to touch a little bit on that in terms of, the work that you do now, and we'll come to that in a moment. But if you're happy just to share your journey, because you do reference that you struggled with burnout and stress, and I would just like you to share a little bit if you're open to that.
Always happy to share. I think sharing our struggles and the darkness, I suppose, is how we help other people to move through those sorts of things. So I I actually really like sharing about what happened with me. So, and it wasn't just nursing, and I think that this is something that I'm super passionate about. Even though nursing was the catalyst, so I was bullied as a nurse. It was the catalyst for a really severe issue, but it was life as well. So we have a lot of stress in our life. I'd had a lot of trauma and stress and problems throughout my life, and I didn't know that that was the case. I'd kind of just thought that that was how life was,
Yeah.
and because I didn't know any different. And then, so when I became a nurse, after a few years in the palliative care unit, I ended up moving to Canberra, and I got what I thought was my dream job. I was facilitating nurses in hospitals, so student nurses in the hospital just down there. And so I'd go over and I'd see them and I'd help them and support them through, learning about what they needed to learn about, do debriefs with them. I loved doing it.
Yeah.
Filled my cup so much, especially when you go in and they'd be like, looking at a set of obs or something and you're like, "Oh, is that right?" And they go, "I don't know." And I'm like, "Okay, let's have a think about X, Y, and Z and what this means." And they go, and you just see this light bulb go on.
It's a great moment, that, isn't it?
You're just so proud of them.
Yeah.
But in the background of that, the people that I was working with, it was quite a complex situation. And the people that I was working with, a lot of them had been there for a very long time. And the job that I had been engaged to do involved changing some of how things were done. And they didn't really like it. And so, despite me trying to be very inclusive of their feedback, their information, engaging all of their experience and knowledge, it just didn't happen, and I was not treated well. And taking it to management didn't help me at all. They just said, "Well, that's just how they are, so you just have to learn to deal with it." And I was trying to study at the same time, so I was studying a full-time master's degree while working full-time, you know, doing the exercise, going out socializing, doing all of the things that we as humans and as women and as nurses, we go, we can have it all, we can do it all, right? But when stress piles on top of stress piles on top of stress and we don't deal with it,
Yeah.
our nervous systems can sometimes go, "You know what, that's enough. I'm not doing this anymore." And that's what happened to me. And my nervous system completely shut down. And I actually got to a point where I couldn't even get out of bed. And it wasn't because I was anxious or depressed or anything like that. My body physically, like I didn't even hear the alarm go off. I got to a point where my legs actually didn't work. So I actually experienced periods of temporary paralysis. And so I was kind of left there then. And the doctors didn't know what to do with me because they were like the usual thing. All my blood tests were fine, my scans were all fine, everything was fine, except it wasn't.
Yeah.
And so they don't know what to do with you. So I had to go through a process now of figuring out how to come back from this. So I could either lay there and just let go of all my dreams and aspirations in my life, basically at, I think it was like 36, I think I was 36, 37, or I could find a way to come back from it and learn from it and maybe even help other people. And that's what I chose to do. And it took me quite some time, but I got there.
Can I ask you, Deanne, because invariably I think when we talk about burnout in nursing, that certainly where I've interviewed people who've had that experience, it's almost like they just carried on, kept going until they couldn't go anymore. And it was like, retrospectively, when they look back, there were warning signs there, but they didn't actually listen. And I just wonder if that was a similar, experience for you. When you look back, were there signs there and you just kind of carried on?
Absolutely. So I think probably about 18 months into my grad year, or no, so 18 months into my nursing career, basically, I started getting really sick all the time. And I started getting really tired a lot. And I'd go to the doctor and they'd say, oh, it's probably just a virus, or you're probably just stressed, or you probably just run down, or you just need to take a couple of days off, And I was like, oh, okay, then, I just need a holiday. So, you go have a holiday and you come back and you'd be okay for a couple of weeks. And invariably, you'd end up starting that slippery slope downhill again because nothing had changed. You hadn't changed anything and nothing had changed where you're working. You just kept doing the same thing because why not? You felt great now. It was fine.
Yeah.
And then you go down the slippery slope again and you're like, oh, well, I probably just need a couple of days off. So, you'd take a sick day or you'd go, I'll plan some annual leave for in 3 months' time and I'll just keep pushing through and it'll be fine. But yeah, so there were warning signs. And I think some of them were very obvious and some of them were not.
Yeah.
And a lot of them, when you go to the doctor and say, I'm experiencing these things, the doctors go, everything's fine. You're
Yeah.
just stressed.
Yeah.
Maybe it's because they can't see anything physically on any of the tests that they're doing. And it's not something, I guess, that they are usually equipped to deal with
No.
because most of it's more to do with our mental, emotional, and spiritual well-being as well as our physical, obviously. But, a lot of it comes down to things that you can't see and you don't know about until you know.
And it really is, isn't it? It's like you say, the physical checking, that's the very medical model, but actually your body is screaming out, really,
Mm.
I can't take any more of this. And it's, we've pushed ourselves to that point where physically things are not working properly. And it's almost like, well, if you're not going to listen to the inner voice, then we're going to, something's going to make you stop in your tracks, which is really what happened to you.
Absolutely. And I think that that's one of the big things, we've all got that it won't happen to me thing. And we've all got, well, I'm still I can still function, so I'll just keep going. And that's conditioned into us, I think, not just as nurses, but in society. There's such a societal thing of work hard, play later, rest later, you know, sleep when you're dead kind of stuff.
And then, sorry, you go.
Yeah, no, it's just, it's damaging.
Yeah. Yeah. And there's stigma around it. I think even though there's so much more now, I mean, there's two things I think have happened around burnout. There's, well, three probably. There's stigma, which people, within the profession, this isn't just nurses, it can be doctors. Doctors have similar problems in admitting A, that they're struggling, and B, that, burnout is happening to them.
Mm.
And I think the other thing is it's become a bit of a, I want to say trendy word, and I'm not taking away from burnout when I say that, but I think people misunderstand the difference between, a stressful day and the
Mm.
cumulative effect of many things that lead to burnout. So you hear people describe, "Oh, I'm burnt out," when really that's not that's not
Yeah.
what they mean. And I think the two things get very mixed up. The actual experience of burnout, we know because of the research, is that cumulative effect of
Yes.
keeping going. And as you put really well, the circumstances don't change. So the working environment doesn't change. The shift hours don't change. The double shifts don't change. So even if you have time away, coming back to those things that haven't changed, you still stepping back into the factors and the situations that created your burnout in the first place. So it doesn't go away. True burnout doesn't. It's an insidious process. And invariably, many nurses that I speak to, things only change when literally they can't go to work. They can't get out of bed to go to work anymore. And that's the tipping point. That's when it becomes okay, something's got to change, because if it doesn't, I can't do this anymore.
I think it's really it's a problem that society has come to this point, and we get told, "Oh, if you rest, you're lazy. If you self-care is selfish," and all these sorts of things. And now we're starting to normalize. I see, obviously, I spend a lot of time on social media doing what I do, and I know you do too. And the amount of people that are making jokes about or normalizing
Yeah,
the burnout, the fatigue, the exhaustion, and it's almost like it's a competition as to who's the most tired or who's done more extra shifts or who's had the least sleep. And it's become this thing that's normal now. And we're teaching our new nurses that the harder you go, the more valuable you are. And it just keeps going round and round in circles. And
yeah,
we're getting more and more burnt out nurses. And
that's
there's
true. Yeah,
hundreds and hundreds of burnout coaches out there,
yeah.
but nothing's being done to
No,
stem the flow.
no. And I think that leads very nicely, I think, to the next thing that I want you to share, Leanne, is, so kind of what did you change as a result of your experience? So, you described physically how you were struggling, with paralysis and lots of other things. But what did you change then as a result of, that experience? How did you, because I think that's the other thing. Sometimes nurses look to, well, the organization doesn't do X, Y, and Z. So they look externally. Well, yes, that is a factor sometimes. But I think it also has to start within, in recognizing what is it I need to do or change and do differently, because some of those external factors we can't always change. But what
Mm,
we can change is ourselves and how we approach taking care of ourselves. So looking after you.
absolutely. And I think so some of this comes to my dad taught me. He learned the serenity prayer, and I'm not sure if you're familiar with it.
Yes.
And I'm not a religious person, but the essence of it is to have the serenity to accept the things you cannot change, the courage to change the things you can, and the wisdom to know the difference.
Yeah.
And I think that is so important. So I can't change. So we as individual nurses can't change the environments that we're working in. As like we can't alter how they function. We can
No.
ask for it to change. We can
Yeah.
maybe influence it sometimes, but we can't actually change it. We have power over ourselves.
Yeah, absolutely.
And this is where I took back my power is what I did.
Yeah,
And it took time to learn how to do that because, like so many people, I had been taught to stay small and just toe the line, and that, you've got no real control over anything. But what I learnt was, and a lot of this was through, I started having Reiki therapy, I started meditation, I looked at the food that I was eating, I looked at some of the habits that I was doing. I considered things that I was accepting that maybe I shouldn't be accepting,
yeah,
not just at work, but in life in general.
yeah,
And I made a lot of changes inside me first. So the way that I was thinking, the way that I was living my life overall.
yeah,
So that's where I started with it. And that then allowed me to be able to create boundaries,
yeah.
which meant that I could then confidently and comfortably, if something wasn't right, say, no, that's not okay. And nurses don't do that very much. We do what we're told to do because that's what we've been taught is the way you do it. The whole idea of being doctors' handmaidens still exists
Mm.
inherently in the way that we're taught, even though we're taught that we're a profession on our own right. And even though we're taught that we don't have to do that anymore, somewhere deep down in the DNA of a nursing everything is still this self-sacrificing, giving, utter complex that we have to give and give and give and give, and we're not allowed to have boundaries for ourselves. And I learned that that was not okay, and that I could put boundaries in place, and I could say no, and I could control what I accepted and how I showed up.
And I think that's crucial because, you know, as you know, that's a lot of the space that I work in around kind of leadership coaching and how to set boundaries and how to say no, because invariably people say, "Oh, I can't do that. I can't say that." And I said, "Yes, you can. You can learn how to do that in a professional, respectful way. But
Mm,
these are the things that we're not teaching. You know, we're not giving people the right tools and techniques to really be able to create healthy boundaries and not feel guilty about it.
mm,
You can prioritize the things that you need to prioritize that mitigate the stresses and the anxiety and the road to burnout, if you like.
absolutely.
So in terms of, you've talked there about your personal strategies. Again, I just want to touch on that because I know also in the nursing profession, there can be a lot of eye rolling when you talk about mindfulness and meditation,
Mm.
oh, not that again, and I've experienced that when I've talked to people about it. And I'm curious to know, because I know you do a lot of great work coaching graduate nurses. And I'm curious to know, do you teach them some of this, Deanne? And how receptive are they to that?
Think that there is, I mean, I make it very clear in the everything that I put out there that these are part of my strategies, that it's a very holistic strategy and it starts with you as an individual.
Yeah.
So only people that really want to engage with that, I guess, turn up.
Yeah.
If somebody didn't believe that meditation was going to be of any help whatsoever, then they wouldn't sign up to my program
Yeah.
probably. Because the last thing that they're gonna do is turn up and go, and I'm gonna go, "Okay, well, maybe try meditating." They go, "Oh, that's just woo-woo rubbish." Like, that's not, so it's the people that are drawn to it in the first place, I suppose, will turn up and be receptive and open to those strategies and those things that I weave into it, yeah.
Because I think they're hugely important. And I totally get that. Not everybody is going to appreciate how those modalities can help. And I think that's part of the problem also, that we don't talk about that enough in terms of how it can help you. And we're not giving people access necessarily to try it. Workplaces are not really thinking along the lines, and this is one of my biggest bugbears is, the whole nursing day, and it's like muffins or cupcakes. And I was like, can we not do something a bit better than that, that supports people, to help people understand that there are lots of techniques and tools that you can have. And I like to think about it as a toolbox, that you have all these things in and you know what to pull on at various points. And that to me is much more helpful, and useful than the tokenistic approach that we often see. So it's really interesting because like you, I practice meditation and I found that quite late in my life, but it actually makes a massive difference, if you do that regularly in terms of yourself, how you regulate, how you deal with things. And I think it's hugely important. And again, we don't introduce these things early enough into nurses' careers. They should be in the training. That's what my personal thoughts. We should be doing it right at the beginning and threading it through.
Well, and that's what I think too. And I mean, I've tried to incorporate it into workplaces, and I've tried to talk to. I work with universities doing teaching and things like that, and I've tried to weave it in here and there, but there's just no space for it. And that's probably why I created my program the way I did. It's the missing semester.
Yes, I like that. It's
It's
great.
everything that was missing, they've been taught all of the clinical skills and all of the laws and all of the pharmacy stuff and all of
Yeah,
that stuff. But what about you as a nurse,
yeah,
as a
yeah,
human being who is doing nursing?
yeah,
And, these sorts of things, people have been reluctant. I think, they say it's all woo woo, but I know we're all trained to do evidence based practice. So I've
yes,
actually looked into it, and I've done different courses and different training around meditation. And there's actually evidence behind how meditation works, how different forms of energy healing can work. Because if we think back to our very first science classes,
yeah,
everything is energy.
absolutely.
Everything is made from energy. We are made from energy. The desk, the everything is made from energy. So, and the scientists from way back when so if it's done right, I mean, not every form of meditation is going to have the same effects on us, but if we find what works for us, then absolutely, it's one of the most beneficial things that I think I have found of
Yes,
everything that I
yeah,
have done and everything I still implement. I'm not saying that it's the only thing,
no,
but it's certainly been meditation has simply been one of the most accessible,
yeah.
simple, and effective things that I've ever used.
And I'd agree with that, Deanne, because I think, the more that you do that, the more it opens you up to look at other things and learn more and understand more. And it's really interesting because I can remember it's quite a long time ago. It was when I worked in the UK and I went to a conference and it was all about long-term conditions and self-management. And there was a speaker that had come over from America and she was a doctor and she called it integumentary therapy, which is a term I hadn't really heard. What she was talking about was therapies that work alongside health and the medical profession. And in certain places in America, they train their junior doctors in alternative therapies. So it literally, they learn side by
Mm.
side because there is the acknowledgement that these therapies have a place in health and not everything has to be surgery or prescribed medication. And in many ways, I know a lot of the hospice movements have and do that very well, but it's almost like we need to do that on a bigger scale
Mm.
because there's evidence there that supports these therapies. There's also evidence that, you know, medical students who have that awareness are more likely to recommend and think differently about how those, you know, therapies can supplement somebody's journey recovery. So I think it's fascinating. but it's still a challenge because, as you say, not everybody and not every organisation is open to it.
I think it's really interesting as well because when we go to university or TAFE, wherever it is we're doing our training, we're taught about holistic healthcare.
Yes, we are.
We're
Kind
taught
of get
about holistic healthcare. So they talk about your physical, mental, emotional, spiritual, and social well-being. And yet, just about everywhere you go in the healthcare system, most of it is focused solely on the physical
yeah,
problem
yeah,
that exists.
yeah,
And they look at the one problem. They don't necessarily always look at all of the problems that exist in that person that could be interrelated. And they don't look at the different options that might help them. We know, as you said, hospice and palliative care and stuff, they do a lot of it really well. We know that when a person has pain from a tumor or something like that, it is exacerbated by their emotional, mental, and spiritual pain as well. And if we deal with and help them to manage their spiritual, mental, and emotional pain, their
yeah,
physical pain is actually reduced.
yeah, yeah. That's true.
It's science, and yet
Yeah.
it's still, as you said, it's still not accepted or woven into things as much as it really could and probably should be.
And I think the other thing around that, some of what I've learnt and what I've practiced for myself made me question, how as nurses, we don't understand how to manage energy very well. So if we're working in an environment where, if we take palliative care, for example, you know, the energy there can be very heavy, and we're not always taught how you manage that on a personal level. How do you, when you've had a difficult, challenging shift and you leave the hospital, how practically do you leave some of the dense energy that you've been working with behind? Because hospitals hold all that energy. And I think, again, we're not taught how to do that. And that's an important part of, disconnecting, to be able to go home, to be able to then prioritize self-care. You've got to have that process to leave that energy here. And I
Yeah.
don't we talk about that enough either, or teach people how to do that.
Think a lot of that comes back to that woo-woo thing though, right? So people don't acknowledge that there is energy associated with feelings, emotions, and processes that happen in those spaces. People don't acknowledge that, by being in that room, that person dying, and then you've got all the sadness and grief and everything in that room. And then you absorb that because it floats around and people don't, they're like, oh, that's just some woo woo rubbish. Like, that
Mm.
doesn't happen. But it does happen.
Does happen. Yeah.
And it affects us on a physical level.
Yeah. Yeah.
And that's where, yeah, we don't get taught, okay, well, here's some techniques and strategies that you can use when you leave the hospital, when you arrive home, when you walk out of the room to start releasing that. So you're
Yeah.
not carrying it around. And now you're carrying around people that don't get taught.
Yeah.
They're carrying around 1 year, 10 years, 20, 30 years worth of, you
Yeah.
know, trauma and problems and everything else with them because they've never been shown how to release that.
And I think that there you go.
They just think it's normal.
Yeah.
We're supposed to feel like that.
That's also can explain why we have some of the hardened attitudes in nursing, because people carried that for a very long time and don't know how to deal with it. So you kind of internalize, bottle it up, don't realize, and it can produce this hardened, not compassionate approach sometimes. I think there's a lot in that comes from what we've talked about. And I think, the whole energy thing comes in your semester, the missing semester. I think that's a great term. I love that, because these are the things, if you were going to put in, that would be one of them. And yes, some people are going to think, woo woo, but I do sense there's a lot of things changing. I think a lot of certainly the new graduate nurses, my experience during COVID, I'd spent a lot of time working with graduate nurses. And what was interesting for me was the conscious decision not to take a full-time
Mm.
contract. They would take a part-time contract and supplement with something, and these were their words, that was less stressful. So they would acknowledge that acute care was tough. So not going to work full-time hours there and do something else that complements but isn't as stressful. And I think that, the new generation of younger people coming into nursing are not necessarily going to tolerate things the way that has been tolerated in the past. And that's good, because I think that starts to agitate for change. So positive, I think. So coming back to your work that you're doing now, Leanne, because you're doing really important work with graduate nurses. And I'd just like you to share a little bit about that work and, what attracted you into that as well.
Yeah. So, as I mentioned earlier, I just thought if I didn't have everything that I needed, I always wanted to do education in some way, shape, or form.
Mm,
When I had my breakdown, burnout, whatever we're going to call it, which ended up becoming an epiphany, I suppose.
yeah,
Whilst I was in that recovery phase, I went, well, what if we could help nurses learn how to do all of this stuff that I'm learning now before they get to the point of burnout? What if we could go upriver and stop them from falling in the first place? And so I thought, well, and this was probably about 5 or 6 years ago, I had this. And I was like, how would I do that? And of course, my immediate thing was put it into the university curriculums.
yeah,
But I've quickly realized that that was going to be extremely difficult to do. I thought, what if we put it into the grad programs?
mm,
Again, though, very institutionalized, very systemic, very difficult to do straight up. So I went, well, I'm just going to have to do it myself.
yeah,
And so I tried a few ways of doing it, and I've finally found a way that works now for me. And I've built a 6-month program to help nurses to transition into that practice, because I know for a fact most universities have a transition to practice subject,
yes,
and it touches on self-care, transition shock, some of those sorts of things a bit, but there's no real detail or practical kind of, it's very academic
yeah,
as it is. I mark into some of those subjects with university, so I understand what's in there.
yeah,
And what it's a great start, it's not enough. So I decided that I would build this program, and it's, like I said, and essentially the missing semester where people can learn about time management. I mean, how many times do you hear new nurses being told, "You've got to work on your time management"? But nobody goes and helps them and shows them, "This is how I do it," or "This is what works for me," or "Try this." Just work on it. Somehow work on it, but we're
yeah,
not gonna tell you how.
yeah,
Self-care, what does that mean? It's not just bubble baths and
yeah,
champagne, how does that work? Integrating how you look after yourself holistically
yeah,
so people can create a self-care plan.
yeah,
We create care plans for our patients all the time. I really try and weave in the stuff that we already know that we do for patients, that we're taught that we should do for everybody, but we never
yeah,
taught we should do for ourselves. So treating ourselves as we treat our patients, giving ourselves the same time, space, grace, and attention that we give to our patients, and doing it from the start, because I've always said creating all of these healthy habits and helpful habits early means that you're less likely to fall into those not so helpful habits that then can lead to, burnout situations. Yeah, there's a lot included in it. It's just 6 months for a reason because there's a lot of key things that are included in it: boundaries, communication, career planning. Everybody thinks that they've just got to climb the ladder. Well, what if you don't want to climb the ladder?
It's fascinating because I deal with, I work mostly with nurse managers who are newly promoted, and a lot of those issues are similar because we've not taught them from the beginning.
No.
So they arrive into a management role and it's like, I don't know what I'm doing. I don't know how to manage all this. And it literally is some of those things that you've mentioned there: time management, boundary, prioritizing self, you know, and I think more so important because your team looks to you as a leader if you're in that role.
Mm,
So if you're not setting the foundations, and that's something I teach, is the foundations of leadership, and the first one is foundation of self, because if you're not applying these things to yourself, your team are not going to do it. So it's not just you, then it becomes this knock on effect of, if you're coming in early and working late, your team's going to think that you will expect that from them. So it's such an important conversation to have early on, but then I think also just to keep that momentum throughout the career, because the stats on burnout, particularly in Australia for nursing, they're also not good for doctors, are really high.
mm.
We're not good at understanding why people leave. We don't capture that. Part of me thinks because they already know the answers. And if you know the answers, you've got to do something about it, so it comes back to money. But we can't not pay attention to that because globally we're all pulling from the same pool effectively. People move around, countries recruit from other countries. But if we don't look after those nurses that we're investing in, they're going to leave and walk out the door. And I just think we're missing something really fundamental, because the answers are there. People like yourself, there are other nurses who are working, supporting nurses. We know that things need to change. And it's like, there's no one listening.
It's really interesting that you mentioned the global thing because we know that there's a global shortage of nurses.
Yes.
I know from the research that I've done in creating this business that this is a global problem. This is not just a problem in Australia or the UK or America. It's even a problem in the Asian countries. It's a problem in Africa. It's a problem everywhere, which points to not a culture as a country or you know, it's a nursing culture problem. It's
Yeah.
a healthcare culture problem. And we know that approximately 25% of new nurses will quit within their first year. But the data's a bit iffy, as you said. They don't want the numbers because once they've got the numbers, then there's hard evidence that something is very, very wrong. We already know something is very, very wrong. No, we're not teaching nurses to look after themselves. We're not teaching leaders to lead. We're not teaching nurses are supposed to educate people, but we're not teaching them how to do that either. There's so many gaps. This thing's Swiss cheese.
Yes. But then equally, if you look at how many people like you and me, and I know there's lots and lots of nurses now stepping into coaching, we're all in our own way trying to support and help and address some of these issues. But yet, we're all doing it in our own single way. And I just, there's nothing that's pulling all of that collective wisdom and knowledge together, because that's actually a really powerful force to be reckoned with. We're all saying the same thing. We've all arrived at this point because of our own personal experiences, and what we've experienced. And that's that epiphany moment where you think, this has got to change, and you know what needs to change because you've worked in the system for a while and you've got to grips with it. And yet no one's wanting to hear that. And I think we're going to be in a mess in nursing. And I say this all the time. I think unless we start to really have these honest conversations and really start to understand and capture the data about why people are walking out the door, particularly in nursing, globally, not just in Australia, when we are going to end up with a very difficult scenario because we know the population is aging, so the demand for healthcare isn't going to go away.
Yeah, and I mean, I'd like to think that there's more and more of us doing this work all the time.
Yeah.
And I would like to think that, you doing podcasts like this where people share their stories
Yeah.
so that people don't feel like they're the only ones, I think is great. I think people doing, we've got social media now, so all of us sharing our stories, our work, all of these things. And if I can get enough graduate nurses to go, actually, I'm going to do this a different way than what everybody else says it should be done,
Yeah.
maybe we can start a revolution
Yeah. Yeah.
and
Yeah.
change. I'd like to think that that will happen.
Me too, dear.
And I'd like to think by all of us connecting in these ways that, maybe if we keep doing this, then we will start that revolution and, we'll begin more and more challenging that outdated
Yeah.
self-sacrificing martyr culture, and it will become unacceptable. And then the system will have no choice but to change because people are going to start pushing back. And I think that that's one of the things that I really hope to achieve in doing this graduate nurse coaching is to teach them early to push back and say
Yeah.
no and not accept the treatment, the behavior, the conditions, because we go, oh, I have to do it. Well, no, you don't.
No, absolutely don't. And I think saying no is one of the biggest issues and the most difficult issues, because to say no to the extra shift or the double shift that is going to, absolutely wear you out, knock you out for a few days afterwards. To say no to that, then you've got the whole issue about, that's going to fall back on your colleagues and your team. And I
Yes.
think, there's a lot of shame. I know Brene Brown talks about shame and guilt a lot in her work, and I think that's also part of the problem that we have.
Absolutely. Because we want to be a team player, right?
Yeah, yeah, absolutely.
And it comes back to that martyrdom that we're
Yeah,
heroes, we're angels, we're self-sacrificing. We're nurses, so we have to be that way.
yeah. Well, we
Um,
don't.
and we don't. And this is culture shift that we need is to say, no, we don't need to do that anymore. It's not your fault that, there's not a staff member there. And I'm not blaming the managers or the leaders because I know that
No.
they've got a very difficult
Yeah,
job as well.
yeah.
It's a systemic problem.
It is.
But, we as nurses on the ground especially, we can't be held accountable for short staffing or
No,
for
no,
anything like that.
no.
And then we burn ourselves out and then we're no good to anybody.
Conscious of the time, Deanne, and we've covered a lot. I really would just like to ask you now, and I always end with this question, and then I'll give you the floor to talk about how people could contact you and how you support the growth. But my last question for you today is, knowing what you know now, after everything you've gone through and everything you've experienced, and you've shared that very openly and very honestly, what advice would you give to a young nurse who's just starting out in their career?
Tell them that nursing isn't about being the tiredest, the toughest, it's not about working harder, more hustle. It's not going to get you ahead. It's not going to improve how you care for people. What's going to help you care for people is being the most human. So being a human first rather than trying to be superhuman is going to make you a better nurse, and it's going to make your work and your life align much better in the long run. you matter just as much as anybody else, just as much as your patients. You are just as important and just as worthy of care and support as anybody else.
Yeah.
Don't lose that.
And that's fabulous advice. I love the you matter because every nurse matters. And I think that's really, to round off what we've talked about, that's really great advice, Deanne. And I just also like to give you the opportunity now just to talk a little bit about your coaching, how people can find you and how that works. Because it's specifically graduate nurses you're working with, isn't it?
Yes. So I aim my coaching at graduate nurses. So whether you've got a grad program or not, because we know that not all grad programs are created equal, and most of them are not going to include anything to do with you. It's mostly, again, to do with clinical skills and how you can fit into the organization that you're with. So my program focuses entirely on the graduate nurse as a human being first and helping them to fit their nursing career into their life, not the other way around. So the Thrive program that I've created, it's a 6-month program, and it goes all the way from transition to practice, holistic care, all your communication, interpersonal skills, goal setting, and carrying that through long term into your career, and even being able to share that with other nurses you're going to end up mentoring, because you will. So people can get a hold of me on Instagram. I am a graduate nurse coach on
Yeah.
Instagram and on Facebook, and I share tips, tricks, and everything else there. And there's also links there to my program, and I also have a free guide on confidence for new graduate nurses there as well.
I will also put the links in the show notes, Deanne, so we'll work that out if you want to share those with me, and then I can put them in the notes for this
Absolutely.
episode. Deanne, it's been a real pleasure today to hear your story, and I really appreciate the honesty in sharing, because that's an important part of what these podcast interviews are all about.
Mhm.
And I think, I just love your approach and how you described your journey and what you learned and your epiphany and some of the things that you have implemented and how that now threads through into the work that you do with graduate nurses. So I'm really grateful for your time today. And thank you so much for being a great podcast guest.
Thank you. I'm really appreciative of the chance to share my story, and hopefully it helps people.
Yeah, I'm sure it will. I've no doubt about that.